Hi, guys. Today I want to talk about something different from my Bible study, my Bible teaching. Today I want to talk about breast cancer and my breast cancer diagnosis. Um, this is Breast Cancer Awareness Month, and I wanted to give back. I wanted to reach out, let people know about my journey, and to tell you, what happened. Um, I was diagnosed with breast cancer in 2021 during COVID. I went for my yearly mammogram, and I had the mammogram. I went home, um, and I had just started leaving. I used to wait for the doctor to get the results, but a couple of years ago I started leaving. But this time I left, and I got a phone call that I needed to come back, and they needed to do another mammogram. So I'm wondering, you start to wondering what's happening. And I'm thinking I had the COVID shots, so I'm thinking maybe my lymph nodes were swollen because of the COVID shot. So I went back, and that's what I said to the doctor. He was there this time. And he said, no, we see something on your mammogram. So they did a repeat mammogram, and then they took me in to have an ultrasound. And so during the ultrasound, they detect where the tumor or whatever they see, where the tumor is, so they stop and they take a piece. They were taking a piece for diagnostic purposes. Now, when I first heard this, my initial reaction was unbelief because it's like, I mean, who goes to the doctor and think that you don't think that your mammogram is gonna show a tumor, even though it happens, but you don't think about it as far as you don't. It's just something that I never thought I'd hear. I never thought I'd hear that. But I wasn't shaken. I didn't fall apart. Uh, I had many thoughts going on in my mind, but I didn't fall apart because I knew at that moment that you know it's harder to get back up from something. If you go get depressed and get down from something, it's harder to get back up than it is to stay up. So I did everything in my power, and giving all glory to God, giving honor to God to help me through this process. And I had a feeling that I would be okay, but I still didn't know what I would have to go through, what I would endure during the through this whole process. So after the ultrasound, the doctor called me, I think it was 3 days later, and said that it was positive for breast cancer. And I had the breast cancer that most people get, is the one that I had. I had estrogen receptor positive, progesterone receptor positive breast cancer. So he sent me for an MRI, and I had that. I had the MRI, and it showed that the cancer had not spread according to the MRI. But I'm finding out later um, that sometimes the MRI may not pick up everything. So I had the diagnosis, and my daughter went with me to get the results of that, and he said it wasn't as bad, as a lot of people's. At that point they said it was a stage 1. So we left. Now after that, I had to find a surgeon. So I reached out to my PCP, my medical doctor, and I reached out to my GYN. And they both recommended the same person, which is a well-known surgeon in Rochester. So that was my confirmation. A lot of people, they say get a second opinion or whatever, but that was my confirmation. I had two people sending me to the same guy. So I consider that as my confirmation. So I called the surgeon's office, and my PCP had already, I didn't realize that he had already sent over all of my information and scheduled an appointment to see the surgeon. I got to see him. He's a busy man, so, it took a minute. I got to see him. But after I saw him, let me go back. I decided, when you have a diagnosis, you've got to decide for yourself what course of action that you want to take, whether it's having your breast removed, both removed, one removed, lumpectomy, or whatever you see fit, along with your surgeon. And one thing about him, he didn't recommend I go the course I took. He agreed with it, but it's ultimately my decision, and that's what people need to know. It's your decision, and if you don't like the decision, that if you have a surgeon that wants to tell you what to do, then you go and get a second opinion. But we talked about it. He said it was no big deal. He agreed with what I decided. I had done my own research. Now, I'm a registered nurse, but I don't know everything about cancer, or it's not something I studied intently, until after I received my diagnosis, but not even right then, because I don't want to get bogged down with all the information from other sources and from other people, and not letting what I'm reading hinder, what's in my heart. Because when I first was diagnosed, I prayed to God for a healing. I'm a Christian, and that's what we should do. We can pray for a miraculous healing to God, but healing comes in different forms. Some people are healed instantly. Some people are healed through doctors and other means. So just because you had to go through a process doesn't mean that you wasn't healed, right? So I went to see him, and he was really booked. So it took I went back a month. After a month, it took about a month. And in that time, I'm thinking, man, is it spreading? What's going on? Is it getting worse? Should I go to another surgeon who may be more readily available? So I had to deal with that. But I decided to stay the course and to stay with this doctor. So I was diagnosed on July 7th is when they got all the information for the diagnosis, when they got everything back, of 2021. And my surgery was September 8th of 2021. Yeah, so July, August, September, so almost 2 months afterwards. So, like I said, all these things are going through your mind. Your fear tries to creep in, and you got to fight that off. And just stay, just stayed in the Word of God and tried to stay up to the best of my ability. So, of course, I told my daughters, I have 2 daughters, my son-in-law, I told them, my niece that lives with me, I told them about it. But I didn't tell other folks. I told them a little bit at a time. And some people I told after everything was done. Some people I told during the process. And I chose to have a lumpectomy. And that's the removal of the tumor and so much a widespread area around the tumor, to remove that. So that was my choice. Everybody choose what they feel is best for them. Cancer, it's a horrible disease, and it affects people differently, and that's with any disease. So each person try to make what decision that's best for them to make, what's best for their lives. Some people refuse to have chemo. Some people refuse to have radiation, or some people say, I'm going to have radiation and not chemotherapy. And some people choose neither. They've heard so many things about the side effects of chemo and radiation that they don't want either one of them. And that's their decision. They have to live with their decision. So I made a decision, my decision, based on the information that I know, and from being a nurse and from the stuff that I gathered and from talking to the different doctors, talking to the surgeon, talking to my primary care doctor, talking to the radiation oncologist and the medical oncologist um, about which way to proceed for me, what is the best option for Flo to take. Okay, and one of the reasons I didn't talk a lot to friends or family about it is because people put their opinions on you. Some people may try to influence you a certain way or not. I don't know, but I didn't choose to go that route. And some people I hadn't talked to, they're my friends, but I hadn't talked to them in years. But what do you want to do? You want to call somebody up? I haven't talked to you in a year or two. I have cancer. I have breast cancer. It just didn't feel right to me. Some people I told, some people follow up with you, some people don't. You tell them, and there's no communication afterwards. Because I don't know, sometimes when people see you, oh, you're a strong person, you got this, you can handle this, but strong people need help too. And I was reading something or looking at a video where this woman was saying, and it's so true, check on your strong friends. It's not always about the weak friends or the people that you see as weak in your eyes. But the people that you see as strong people need people too. They need help. They need encouragement. They need people, family and friends around them too, but they need the right people, especially when you're going through an ordeal that's so serious. You don't need someone that's going to be a naysayer. Some people talk about, oh, my uncle had that, he died. My aunt had that, she died. Yeah, she fought it for a little while, but she died. I mean, and I know that people don't mean to or want to make you feel bad when you're sick. I don't think it came from a bad heart. I think that's all they knew to do or knew to say. That's all they had to offer, which I wasn't ingesting. I don't want that. I don't want to take that in. So I didn't want to be around negative people or people that I felt would take me down or say things, even though there was a few, but they said it out of ignorance, not in a way to hurt me. I heard that chemo's something else, man, stuff like that. I don't mean, I know that they didn't mean to hurt me. I'm looking down at my notes because I'm trying not to forget anything about this. So I had an appointment to see the radiation doctor before my chemo doctor. I decided, and I'll tell you why, I decided to receive radiation and chemotherapy, or vice versa, chemotherapy and then radiation. But I got an appointment to see the radiation doctor first, and we talked. And what I did too, which is a good thing for people to do, because you're so caught up in your emotions and what's going on with you, it's hard to remember or to stay fully present when you're talking to the doctors or your treatment team, because your focus is on so many things. You're still focusing on being sick. You're focusing on the journey. You're focusing on, am I going to get well? All of these thoughts still go through your mind because you're human. So what I did with my appointment with the radiation oncologist and with the medical oncologist was I taped my sessions with them. And it was a good thing I did, because when I got home and I listened to these tapes, I heard things that I didn't hear. And when we were talking, it's like, I don't think I blocked them out, but there was so much to process. And I think each one was over an hour of conversation and trying to get your questions in and talking about the therapy you need or what they recommend. But we need to remember, it's still our choice as to what we agree to receive as far as radiation or chemotherapy, or with chemotherapy, chemotherapy, there was different, there was three different options, but I'll get there. So the radiation therapist told me that he was 100%, 99%, wasn't 100. I'm 99% sure that you won't need chemo. So it's like, oh, wow, okay, that's great. And I hung out. I said, you sure? You got everything? He said, yeah, I'm sure. I'm not. He said, they won't give you chemotherapy if you don't need it. You're not going to need chemo, but you're going to need 16 rounds of radiation. So I hung on to those words because okay, I don't have to have chemo. This is great. I don't want to have chemo. This is good news. Okay, so I leave there. I make an appointment. I hadn't seen the medical oncologist yet. And I also, like, I asked the radiation doctor, did he have all the information that he need? And I didn't say, do you have the right information, everything you need to make this decision? I just said, do you have all of the information? I meant my paperwork, my reports, and everything like that. So I assumed that he had everything, that he needed. So about a month or so after, I saw the medical oncologist, who was the chemotherapy doctor. I talked to her PA, physician assistant first, a nurse practitioner, I'm not sure which one it was. Before I talked with her, they gathered so much information, and she said in the interview that you're going to need chemotherapy. And I said, no. I said, that's not what I was told. The radiation doctor, and I gave him the doctor's name. He said, no. He said he's 95% sure that I won't need chemotherapy. So I'm thinking, this woman don't have my records. You don't know what you're talking about, and I was getting upset with her, challenging her, because I'm thinking, I'm not going to have it. He said, I don't need it. I'm not going to have it. So then she left, and the doctor came in very gingerly, because I guess she told her that I was upset, and I was. I don't think I wasn't upset to the point of being disrespectful, but I'm hearing different information here, and I choose to believe the radiation guy, because that suits me. I don't want chemo. So I'm going to go with what he said, and then you got to prove to me why, or tell me why I do need chemotherapy. So she went over my records, and she brought out this piece of information that the radiation doctor did not have. And I thought he had everything. And apparently he thought he had everything. So this information was what they call oncotyping. And this is a test that scores from 0 to 100, and it tells you the probability of recurrence, and if you should take chemotherapy, radiation therapy, mostly chemotherapy is what a couple other things that this test brings out. It predicts the benefits of chemotherapy and radiation. So the score on the oncotyping is 0 to 100. And over 25, they recommend chemotherapy. Mine was 32. But in my mind, and really, I said to myself, 32 out of 100. That's like a D. 32, that's 78. All this stuff is just going through my mind because I don't want it. I didn't want chemo, and I'm thinking, okay, these numbers is 7 over to 25. Do I really want to take it or not? So I had to decide what course of action I want to take. And the doctor said, she strongly recommended that I take chemotherapy, and for many reasons, and based on the oncotyping test, which, like I say, I didn't want to have. But my thing was, I want to do whatever it takes to get to the other side. I knew this journey. I knew it wouldn't be easy, but I didn't know how difficult it would be, or all of the things I would go through. Now, after I got the diagnosis, I called the Breast Coalition of Rochester, and there's many places you can get information about cancer. National Breast Cancer Society, American Breast Cancer Organization. There's so many out there. I mean, CDC. There's all kind of sites in your hometown. In my hometown, there's so many places I can get information. And I called them. They brought me out a bag with books, candy for nausea, pillows, throw blankets, tons of information on cancer, the different number of breast cancers. I didn't know there were so many different forms of breast cancer. Treatment for the breast cancer, how they measure the stage, how they measure the grade of cancer, and all of those kinds of things. And not only did I get information from them, they were very helpful. If you wanted to talk to someone there, you could call and talk to them. Then what they did, they linked me with a person, they call it a pal, that has the same kind of cancer you have, but it turns out my pal was a little different. It wasn't a right fit for me. But they hook you up with someone that's going through, have the same diagnosis, so that they can tell you about their journey as much as they choose to tell you, but still, it's an individual thing. People can have the same diagnosis, exact same diagnosis, and respond totally differently to cancer or their diagnosis. A lot of it depends on who you are, depends on your background, the way you were raised, maybe your profession, your life, your family, whatever you've gone through or not gone through. All of those things factor into our decisions about what course of action we're going to take as far as our cancer diagnosis goes. And a lot of them, and when I look back, and I knew then, it's like a lot of them hold back because they don't want to tell you some of the uncomfortable side effects that they experience. But these are the kind of things that people need to know. I mean, not to the point of scaring them. And that's what they say, well, everybody's different. And it is different because everybody pain level is different. Everybody tolerance is different. Our lives are different. So a lot of those things are different for a lot of us. And people, I've talked to pals since I became a pal, and I've talked to people since that, since my cancer diagnosis. And I talked to people like one lady said, I'm not going to take chemo, I'll take radiation. This one person said, I don't think I'm going to take anything. My mom had it, she didn't take anything, and she did fairly well. I had one lady talk about her hair. She didn't need chemo, she needed radiation, and she needed to take pills for 5 years to help to prevent the cancer from coming back. And she said, I read that it thins your hair, and I don't know if I'm going to take it. And a lot of us would be like, wow, your hair, life, but that's not my decision. It's not my call. It's an individual thing. And people have to make the decision that works for them. They have to make a decision that they can live for. My thing is there's wigs, and I started wearing wigs maybe a couple years before I got this diagnosis. So that wasn't one of my big issues. And after chemo, I'm going a little ahead of myself here. Well, let me go back. When I signed up with Breast Cancer Coalition of Rochester, they also have groups that you can attend. So I signed up for some different groups, meditation, Tai Chi, some different things. And some of the women in that group, and I remember this one lady um, had said to me that how we stayed on after everybody was gone because I wanted to talk to her. Um, and she talked about how losing her hair in the shower was so devastating to her. And how she said, I just fell on my knees and hit the floor because I'm washing my hair and it's falling off. She said in the shower. And that devastated her. She said, I don't mean to be vain. She said, but that was a hard thing for me, she said. I said, everybody responds differently. That wasn't a big issue for me. Because like I say, there's wigs, there's other things, but I can imagine maybe had I not had that conversation with her and went in the shower and my hair um, just fell off, then maybe I would have had um, a little bit of different outcome. So I was glad that she had actually told me that. So when my hair was braided, so when I thought about that after the chemo, but I didn't know it would start coming out as quick as it did. My hair was braided and something just said, take your hair down. So when I started taking my hair down, it started coming out in my hand, but it was still there because my hair was in braids and it wasn't falling out. But like I said, everybody's journey is different. Everybody handles things differently. No two people are the same. No two people family dynamics are the same. And there's some people that have cancer that have to go it alone. There's nobody there to help them. Or sometimes they don't have families. They may have caregivers or something, which is great. It's good to have somebody um, because it's not something that you should battle by yourself. And I want to stress the importance. Thank God that I'm good at going for my appointments, whatever they are. I'm glad that I went for my yearly mammogram. And I stress that for all women, for everyone, whatever disease or whatever diagnosis you may have, that you follow up with your doctor. Anything that you see that's abnormal or is not right or different, follow up with your doctor. But I'm glad that I went. But in my mind, I'm thinking, was it there last year and they didn't see it, or did it just come? All of these things are going through my mind. But I'm glad that I went for my yearly mammogram, and we should follow up with that. With any treatment that we need, anything we need, anything that's going to help us to get to the other side is what we need to do. And again, I said, everybody they try to do what's best for them, and it's not something you do for other people, even though some people's family that don't want to take chemo or radiation may convince them to take it, or they may go the other route. No, you shouldn't take it because of all of the side effects. But just know the people that are with you and around you, and make sure that you have a supportive team of family members and a treatment team, and not just let family or your treatment team dictate to you what treatment that you should have, because it's an individual thing, and you should do what you feel is best for you. And a lot of my decision, I thought about my children, my grandchild, my son-in-law, my family, my niece that stay with me, my nieces and nephews, brother, my family. You think about them because you don't know what's going to happen. Even though you're expecting a good outcome, you're human. So you're going to entertain fear, but you've got to fight that fear. You've got to fight it off to the best of your ability. When it creeps in, you do something to get rid of that fear, because fear would take you down and it will immobilize you. And my thing was saying, I'm going to stay up to the best of my ability. I'm not going to let this thing get me. I'm going to do what I need to do to beat this thing or to get better. But it's a process. And when the tumor, I didn't feel the tumor. It's like, why didn't I feel it? But it was on the outside underneath my breast, and I never felt it. Once they felt it and showed it to me, I felt it. But it's just I didn't feel it. I didn't know. But I'm glad, like I said, that I went to see the doctor and not put it off or reschedule it. Um, it's very important that we take care of ourselves and do the things that we need to do to stay healthy. Um, so I chose, like I said earlier, I chose a lumpectomy, where they take so much of the tissue. They take the lump out and they take the surrounding tissue. They go for a certain area that spans your breast. And also with when you have breast cancer, the first place that your breast, the cancer will spread will be your axillary lymph nodes. So they check your lymph nodes um, to see if any of the cancer has spread to your lymph nodes. So mine has spread to one of the lymph nodes. I had the surgery. They checked to see if it spread to the lymph nodes. They do what they call a nuclear medicine test, where they gave me lidocaine. I had to put on my breast an hour before the test. And when um, you go in to radiation area no, I don't want to say that. The radiation area. Well, what they did was they inject this dye in your breast, and if there's any spread of cancer, that dye will go to that area, and they can see. So mine showed it had went to one lymph node, but the doctor took out 6 lymph nodes. They want to go beyond that one to see had it affected any other ones. So it was just that one. Praise God. I know people that have had 18 removed, and it's been really, they're still alive. They're good. They have a large amount of lymphedema, that's swelling in their arm and breast and hands and stuff, but they're alive, and that's a good thing. Thank God. Um, so I did that. So the doctor removed that, um, the cancer, and you got follow up with that doctor. So after that was done on 9/8, I talked about seeing the medical oncologist and her recommendation. And like I said, I taped the conversation. I filmed it, I taped it, and I played it back. And like I said, I missed some things because you're so wrapped up into your diagnosis and what's going on with you. After we got it straight, as far as me taking chemo, that I would take chemo, then we could go to the next phase, and that was deciding which course was better, I felt was better to me. She gave me 3 different options. And the third one, she said, I don't really want to go over that one because that's for people that are weak and can't handle much. And I think you can handle the rest of them. I don't want you to take that one. That she gave me 2 other ones. And one of them, this can cause heart damage, blah, blah, blah. This one, the second one, to me was better. There was less, it was more aggressive because it was the treatments was every 3 weeks as opposed to the first one was every 2 weeks, and it was more often. And after I decided on the second one, but I looked up the difference in the percentage rise of where the benefits of the two, the difference. I think it was maybe 1.82 the difference, but I decided on the second course where we take 4 rounds of chemo every 3 weeks. Every 3 weeks. And in the meantime, you have the chemo, but in the meantime, you um, you have your blood work done. You know, they have to check to see if your numbers are still good. You know, if not, if your numbers aren't at a certain level, they can't give you the next dose of chemo. And mine stayed at good levels. Um, so I was able to um, take all 4 at the time that they were scheduled. But there's a lot that happened between there. I don't want to make it, there's so many other things I want to talk about. And I don't want to make the videos too long. So I'm going to end this one today. And I'll follow up with a second video on my cancer journey. Thanks.